name is Daniel. I'm the Orthopedics and Spine Coordinator at Good Samaritan Hospital. My role is multifactorial in managing the oversight of our joint replacement and spine center. Studies do show that coming in for joint replacement, even if it is just overnight, show that you will encounter north of 52 different names, faces, players, and roles. I'm really here to help hold patients' hands from start to finish, give patients really a resource as maybe in the conduit between not just the players here at the hospital, but also to their surgeons' offices and their post-acute providers.
One of the most important factors to take into consideration when you're choosing when to get a joint replacement, either a shoulder, a knee, or a hip, in addition to choosing the right surgeon, is also choosing the right facility. Here at Good Samaritan, we've built a standalone program for the reconstructive surgery of all three.
With the Silicon Valley Joint Replacement and Spine Center, your encounter, your experience begins before you even enter our doors for surgery. I believe in early communication and contact to get you the answers that you need to help alleviate anxiety and educate you on every step along the way. What to expect preoperatively as far as preoperative education. We have different classes available to accommodate your lifestyle. Phase 2 triggers the intraoperative piece itself from the time you enter our doors until the time you leave. And to me, the most important is Phase 3. That is when you discharge from the hospital and the professional help is not around. Did we do our job partnering with your surgeons to get you all the information that you need and navigate your services throughout start to finish?
What a lot of patients don't recognize is that you can go online, you can find the ratings of hospitals and how well they do with all of those surgeries. We have to report how our patients do. So they look at length of stay, they look at the amount of narcotics used, they look at how quickly we get you up after surgery, when you're actually discharged, and what your overall patient satisfaction is with your experience here. And we have consistently improved those numbers every single year.
From implementation, we built this program with one end in sight: to move away from being another hospital in our community who provides joint replacement and spine surgical services to becoming true subject matter experts in this field. We recognize that moving forward with an operation may come with a level of anxiety and also the reality of planning lifestyle adjustments. Here at Good Samaritan Hospital, we are here each step along the way for you.